So we're going to talk a little bit about the COVID-19 epidemic that we have going on right now. Obviously, this is a big deal, and this is a big reason why everybody's talking about immunity right now. So the question is, well, everybody's scared about this illness. What's the best way to go about it? Well, everybody's rushing towards trying to find the next vaccine or trying to find, the best pharmacologic treatment. What can we do to treat you? But when I'm thinking about COVID or the coronavirus, I'm thinking about, what can we do to improve your immune system so that this doesn't end up being an issue for you, and that you are one of those people that gets the mild form of the illness. And so once again, I'm going to just go ahead and I'm going to stop my video here, and you can just listen to me here for a minute. I'm going to talk about this coronavirus here for a little bit and talk about maybe some of the natural approaches for to think about viral diseases in particular. So as my disclaimer at the bottom of the screen says, it's not meant to be recommended as treatment, nor have these modalities been proven effective for the coronavirus. Okay, so I'm not making any claims that anything is going to directly treat coronavirus, because we don't have any proof that that is what happens. But we can go in and say, well, this will probably work. So I'm not an expert in infectious disease or virology or public health, and I'm not going to claim to be that. But I've been listening to a lot of things, and I've been reading a lot of material. And so here's a little bit of a breakdown of some of the things that we might want to think about. So first, what's the virus? So a virus is a microorganism. It's about 100 times smaller than a bacteria, and it needs a host to survive. In other words, for it to cause health problems, it needs to be in your body, in your cells. So the genes in a virus can be DNA or RNA, and COVID itself is RNA, or ribonucleic acid, which serves as a messenger in living organisms or carries the recipe from DNA to make protein. In RNA-only viruses like COVID-19, it is RNA, not DNA. So other RNA-only viruses include hepatitis C, Ebola, SARS, influenza, polio, HIV. Those are going to be your most common ones. So how do they work? Well, once they get into your cells, those viruses blend its RNA with your genetic material and begin replicating or duplicating and infecting other nearby cells until something makes it stop. That something that causes it to stop is either an antiviral or your body's immune system, or both. So different viruses work in different parts of the body. So for example, if there was a rotavirus, that would cause problems in your GI tract, or if you thought about your stomach flu, diarrhea, nausea, vomiting, those kinds of things. Think about herpes and the sores that creates. Influenza, SARS, COVID-19, the common cold. These ones primarily target your respiratory systems. So how does your body protect you from these viruses? Well, we talked about beta cells, beta lymphocytes that produce antibodies every time you're infected with a virus. The antibody can protect you by interfering with this virus from connecting with your cells. It recognizes the infected cells, and then it calls its bigger brothers to come and beat up the infected cells to try to get rid of it. Leukocytes, T lymphocytes, natural killer cells are the stronger friends, or the bigger brothers. During this process, which is technically called cell-mediated immunity, the interaction with the stronger immune cells and the infected cells causes chemicals called cytokines to be produced. Cytokines consist of many, many different chemicals that regulate your immune function and can set up your body to beat a viral infection in the future, which is all good, except when it's not. In the process of protecting you, cytokines from a viral infection may also cause too much inflammation and fluid accumulation in the air sacs of the lungs, known as cytokine storm, which can lead to a pneumonia, which is one of the biggest concerns with COVID-19. So a robust immune system is incredibly important. And we just talked about all of that in the previous webinar. So technically speaking, COVID-19 is not the name of the virus, but it's the name of the disease caused by SARS-CoV-2, which is the real name of the virus we're all concerned about. So if you hear SARS-CoV-2, COVID-19, we're talking about the same thing, okay? The common name coronavirus stems from the fact that SARS-CoV-2 virus has spikes around it in a circular shape. So when you look on TV and you see that circular ball with all the spikes coming off of it, that's where that comes from, which looks like corona, or the Latin name for crown, okay? So how does it get into your body? Well, let me back up. So those spikes that you see are what stick to the surface of your cell that it gets into infect, okay? So after a droplet of COVID-19 gets inhaled, right? So that's the main way that it gets transmitted into people. It attaches to the inner lining of the lung in your respiratory system called angiotensin converting enzyme 2. So now there has become some confusion around ACE2, or angiotensin converting enzyme 2, also known as ACE2, because there are certain influences in ACE2 that we utilize all the time. So if you think about people on blood pressure medicines called ACE inhibitors, also known as, the primary one is lisinopril, okay? That's where that one's going to come into play. We're talking about, should people with ACE inhibitors come off of them if their risk for contracting this virus is high. There's also more ACE2 in people with diabetes, and after ibuprofen consumption, that's where the Ibuprofen Concern comes from, and some diabetes drugs known as Actos or Avandia. The theory and what some people are concerned about is that those medications are making people more prone to COVID-19 infections. So my recommendation, if you're on those things, you might want to talk to your doctor to see if maybe you should come off of those for a short time period and think about different medicines. So what are the symptoms associated with COVID-19? The most common symptom is fever, which you'll see in about 80%, followed by a cough. Many people have just mild or no symptoms. It's really very similar to the flu or the common cold, which makes it hard to differentiate since we were just in influenza season 2. Other symptoms include shortness of breath, body aches, headaches, upper respiratory symptoms. Does it sound familiar? You can be older and still have a strong immune system, but the older one is the older you are, the more work it takes for your immunity to keep up. So it's super important for all of us to stay up on our sleep, nutrition, and exercise, as we already talked about. Symptoms unique to COVID-19. So something else to think about and listen for when you're talking to people that has been reported as of late include a loss of taste in the mouth or a red rash-like appearance around the eyes. Primarily is seen in a fair-skinned person. So yes, it can be deadly because what happens is as that virus gets into the lungs, it causes pneumonia and swelling in the lungs, which affects your ability to get oxygen into your body effectively. People most vulnerable are the older population, especially those who smoke, those with heart disease, high blood pressure, and diabetes. So if you know somebody or you're a smoker, now's a really good time to stop. Think about all those kids who are vaping and how that puts their lungs at risk. Please encourage them to stop now. So it's spread from person to person through coughing, sneezing, and then you breathe those droplets in, or by direct or indirect contact with a contaminated person. So you shake their hands or you touch something else that somebody else touched. So think of doorknobs or a faucet in the bathroom. This is why we're shutting down a lot of public places. Can you have it and not know you have it? Yep. The incubation period can be anywhere from 4 days or less to all the way up to 2 weeks. And some people may not have any symptoms, but they're still spreading it. So what are they using right now to treat this? Well, there's no vaccine yet. They are trialing a vaccine. They are trialing some other medications known as chloroquine or Plaquenil, remdesivir, which is an antiviral, lopinavir, ritonavir. The Plaquenil is showing some benefit per some report, but again, we're not entirely certain of that. So at this point, we're left with treating the people that get incredibly ill in the hospital. But who gets COVID-19 the most? The most? It seems that men are actually more infected and die from COVID-19 than women. At least that's been the reports coming out of Italy and China. The reason for this is not completely known, but a couple theories include that men have a tendency to wash their hands less, they smoke more than women, and in general, women have a stronger immune system. There's a hypothesis that testosterone can weaken the immune system while estrogen can strengthen it. I'm not so sure on that, but it is a theory that's out there. But if we look at history, including if you think about SARS in Hong Kong, MERS in the Middle East, and Spanish influenza, men were much more common to die of these infections than women were. So if you know somebody who's an older male who smokes with poor lifestyle and behavioral habits, they might be the ones who are in big trouble. So if we're going to talk about spread for a minute, there is concern that this virus sticks around a lot longer than other ones. So how can it be spread? I know we talked about contact and through droplets, but this virus can actually stay in the air for about 3 hours. Okay, so if somebody coughs and it's floating around in the air, it may not drop to the ground right away. It can actually stay in the air for 3 hours. They're finding that it can stay on copper for up to 4 hours. Cardboard, 24 hours. Plastics, 2 to 3 days. Stainless steel, 2 to 3 days. So it's really important if we go out, we go shopping, man, we need to be careful, make sure we're washing our hands, covering our bases. So where does the ibuprofen concern come from? Well, the ibuprofen concern comes from the ACE2 concern that we talked about earlier. The French government was originally the one who came out recommending against use of ibuprofen because of it. The theory is that you take ibuprofen. When you do that, you have more ACE2 inhibitors because of how it works, or more ACE2 receptors, which provides more opportunity for COVID to enter the cell, which would make you more likely to get more sick and die from a COVID infection. But within 24 hours of that, the World Health Organization first recommended against the use of ibuprofen and then changed its tune, reversing its stand, now saying that there's no evidence to recommend against the use of ibuprofen. So while it's true that COVID links to ACE2 in the receptors in the lung to get in the cell, less ACE2, not more, may cause more deadly harm to the lungs because more virus will be attached to those fewer receptors. So too little ACE2 receptors, not more in the lungs, may cause more deadly inflammation of the lungs. Does that make sense? So, but if we think about this, ibuprofen and other NSAIDs, I still don't think are the best way to fight a viral infection. And so my recommendation at this point would be, we don't 100% know this to be an issue or not, so it might be best to just avoid them. So if you get a fever, it's okay. It's actually your body's protective mechanism. Let it ride until it hits 103 degrees. And then if you need to take something to help with the fever, stick with Tylenol. Okay? Brenda says say it one more time in simpler terms. So the theory is ibuprofen and how it acts in the body and interacts with the immune system, which it does. And so because of that, I don't like it particularly as a medication anyway, but if we need it sometimes, then it's there. But ibuprofen creates more ACE2 receptors. When you have more ACE2 receptors, which is what the COVID virus attaches to, there is a higher likelihood for risk of getting sick because there's more of those receptors for the virus to attach to. However, the thought on it is that fewer receptors that all have virus attached to them is more dangerous than having more receptors with fewer virus, if that makes sense. And so because of that, the concern about whether ibuprofen is a concern or not is not 100% clear. But staying away from some of these specific medications would be a good idea. So the same thing with lisinopril and other medications that we discussed earlier not to take. So if you think about those medications work to inhibit the ACE receptors, okay? In other words, it weakens your body's response to those enzymes. So if you are not in the greatest healthy state as you can, and those enzymes are not functioning normally, if a virus gets into those cells, your body can't protect itself as well. And so you're going to be more likely to get more sick because the virus can get in easier. At least that's my understanding on how that works. Okay. So again, if we sneeze, cough, make sure that you're using your elbow, coughing somewhere where you're not coughing up in the air. Make sure you're getting plenty of sleep, exercise, washing your hands plenty. Don't shake hands. What else can we avoid? Avoid sugar and processed foods. These are not good for immune system. They create extra inflammation. Make sure that you eat immune boosting foods. So think about soups with garlic, onion, ginger, mushrooms. Make sure that you stay hydrated. 8 to 12 glasses of filtered water a day. Again, dietary supplements, we think about vitamin C, we think about zinc, vitamin D3, selenium, even melatonin, have all been proven to help the immune system. Some people have asked about elderberry and concern with the cytokine storm that has been floating around the media. This, I believe, is that there's truly no evidence to this at all. Elderberry does not work to just increase cytokines in response to infection. Elderberry, because it's an herb, actually mediates infection, or mediates the cytokine response. So in other words, if your response is low, it helps bring it up. If your response is high, it helps bring it down. That's one of the beautiful things about herbs. I love herbs for this, and I use them all the time in my practice. Let me see here. See if there's something else that I was going to talk about. Something else to consider is something called ozone therapy. Ozone therapy is a really, truly amazing therapy using the healing power of oxygen. I encourage you all to check out the American Academy of Ozone Therapy, AAOT.us, and look at the studies that have been done on ozone. There's a lot of different ways to utilize ozone. We can use it to sterilize things, but we can also use it a lot in our body. We can do it IV as well as rectally. We can do injection of the gas into the nose and the sinus, the back of the throat. It's an amazing therapy because what it does is it uses oxygen to help you heal. And viruses and bacteria cannot withstand high amounts of oxygen. And when they're exposed to those high amounts of oxygen, it actually disables them. And so it's one of the things that I have been utilizing in my practice. I've had amazing response with it. Of course, I can't guarantee any benefits with it, but just recently, my wife was quite ill and didn't feel like she could get out of bed hardly. She had body aches and that kind of thing. And what we did is we actually did an ozone IV with her, and by the next day she was 90% better. And we did one more, and the next day she was about 98% better. And I've never seen anybody bounce back from not feeling like they can get out of bed to the next day basically being at full function. So it was pretty awesome. encourage you to do a little bit more research into that, spread the word. I think that we should have more people utilizing ozone therapy as a part of their practice. Brenda's asking about hyperbaric oxygen therapy, helpful as well. It definitely could be in theory. Hyperbaric oxygen therapy, I guess I don't know what the science is on that, or if they've done any research on that. It may be something to consider. I mean, it helps with oxygenation of the tissues. One of the things that I think is really cool about ozone, one of the other facts about it, is that when your macrophages or your white blood cells, as they're attacking an infection, actually release ozone of their own accord to kill the infection. And so we're not introducing something that's foreign to the body. We're actually utilizing a natural form of oxygen that's already produced by the body to help kill the infection. All we're doing is ramping it up and giving a bigger dose of it. So incredibly cool stuff. I really, really enjoyed a lot. So something else to think about. Again, I will send out a specific recommendation as far as some supplements to consider, as far as if you're wanting to support your immune system a little bit better. And we'll make sure that these recordings get out to you as well, so that you can either share them with somebody else or review them yourself again at a later time. And I know there's people that were not here that hopefully will be checking this out later as well. So do we have any other questions before we wrap up today? Was this helpful for you? Did I create more questions than answers? Help give me an idea of where we're at, and if there's anything else I can do or answer for you today. I'll wait for a couple minutes. Repeat the meds that are concerns for COVID. I'm going to pull this up here in regards to, just make sure that I get the full list of them. So the full list of medications were ACE inhibitors. So people that are on blood pressure pills, also known as lisinopril. And there are other options for these medications. So if you know somebody that is on these medications, they should talk to their doctor about whether they should switch those, particularly since our area has not been hit with the virus quite so hard yet. So we're learning from other people that have been dealing with this. So ACE inhibitors or lisinopril. Again, thinking about possibly ibuprofen. I'm not 100% convinced on this, but there's other options, so I would say avoid it anyway. And primarily diabetes drugs known as Actos or Avandia. Those are the primary things that, primary drugs that I would be concerned about considering getting off of at this point. Britta says, thank you, very helpful, fun to hear more of your story, how you got to open your own practice. Thanks so much, Britta. Thanks so much for jumping on. Excited to have you here with me today. Any other questions or thoughts or feedback on things from today? Thanks, Brenda. It was awesome having you here. Thanks so much for attending today. I'll work on getting these presentations downloaded so we can get them out to everybody who registered. So it's been fun. I've enjoyed it. Hopefully it was helpful for you. And if you have any questions, please reach out to me. You can find me at valleyvitalmedicine.com, or at my email is trevor@valleyvitalmedicine.com. So thanks again. Wonderful to see you guys. Glad that it's warming up a little bit outside, and looking forward to next time. Have a wonderful day. Thanks, everybody. Bye-bye.